Well, I've just spent pretty much most of the last 96 hours on call, and it's really, really bad. It's worse than it was in April. The numbers of patients with COVID are just shockingly pouring through the doors of the hospital now, and we've got more patients with COVID within our hospital than we even had in April when we had the peak of the first wave. And it's also worse than April in other ways. The patients are younger, so a lot of people assume that COVID is a disease that only affects very elderly people, and that's just not true. It is not a virus that discriminates. We're having patients in their 20s, in their 30s, in ICU, patients who are far, far, far too young to die, and they're coming in, and sometimes they feel okay when they arrive, and then hours later they're ventilated on a ventilator in ICU, and literally it could be any single person who is listening to this program right now. And the constant just onslaught of patients is really, really tough. They're so sick, and everyone is presenting with the same symptoms. They're breathless. You do a chest X-ray, you look at the lungs, and they're a complete mess. And COVID has a very distinctive pattern, and you see it over and over again. And then where I come in, because I'm a palliative care doctor, I'm only seeing the patients who are the sickest, who we think may die. It's the same patient over and over again, and it's absolutely heartbreaking because you go to see one patient who is fighting for oxygen, fighting for air, and you feel as though you can sort them out, you can help their symptoms with drugs, but you know that there are patients just like that in my hospital, in the hospital in the town next door, and in hospitals up and down the country. And all of this is happening when staff are absolutely broken and on their knees. I cannot tell you how hard staff are working, how courageous and resilient all of the doctors and nurses and everyone else in the NHS is right now. They are working so hard. They're having their holiday cancelled because the COVID crisis is too great. They haven't had any holiday over Christmas. They are on their knees, and they just keep going. And we all do, because you have to, because the patients just keep coming and you have to be there for them. But it's really hard.
How do you cope with this, both emotionally and physically?
Weirdly, one of the hardest things right now in the second wave is feeling as though we don't have the public behind us in the same way. In the first wave, we knew that the country was united. We were facing this awful, once-in-a-lifetime pandemic, and everybody was together. And those claps every Thursday evening meant something. They meant that the next morning, on Friday morning, when you left your house and you knew you were driving to the hospital where you were going to be up close and in an environment that had COVID literally hanging in the air, risking your life and potentially the life of your family, you knew that the rest of the country was behind you. And that gave certainly me, and I know all of my colleagues, so much determination to do a good job. But now you come home at the end of the day and it's just like it was, if not harder than April. And all you find in the mainstream media, the newspapers, on television, let alone social media, you have person after person saying COVID isn't a real disease, it doesn't exist, it's rubbish, this is a scamdemic, hospitals are empty. And you have literally spent all day seeing patients dying of COVID. And that's really hard. And I think morale is very, very low indeed. And that's partly because we need to know that what we're doing is valued, because it's so very hard. And I think what we do is we just, you just look at the patient in front of you and you do the best job you can for them. and you carry that home with you, and you know that you have done something good for that patient, and it doesn't matter how many people deny it. You've tried your best.
It's very moving, Rachel. What can all of us do? The people who are listening to this program, people like me who are presenting it. What can we do to relieve the burden on you to some extent, to some way aid the work that you do every day? How can we support you?
There's two things more than anything. The first thing is, please believe us. There isn't a single NHS doctor or NHS nurse who is exaggerating what it's like in our hospitals right now. Why would we do that? It's real, it's serious, and the best thing you can do is please believe us. Don't believe people who tweet from their laptop or in bed at night. Believe the people who are there on the front line. And then the most important thing above all is please, please, please respect the rules of lockdown and social distancing. Stay at home, wash your hands obsessively, like your life depends on it, because it might. Keep your distance, stay 2 meters from other people if you possibly can, and wear a mask. Please do those simple things, because I don't want to have to see you in 2 weeks' time fighting for your life because you're infected with COVID and you're one of the unlucky ones who, perhaps even if you're young, has been struck down by this horrible virus. So just literally, please follow the rules. That's all we want. We're desperate for it. We can't understand why we're not in lockdown already, but if individuals are careful, then that helps. We don't want to see you in hospital.
You've got a young family. You've had to work over Christmas. You've even been working today, obviously, before you very kindly agreed to come on right now. How does that affect you? How do you cope with it? Do you have coping strategies for getting you through this kind of emotional and physical experience?
Well, in the first wave, my children were very, very upset. They were frightened. They cried because they thought Mum was going to go off and do a job that may kill her, and they couldn't understand how I could care for patients more than them when I was their mother, and that was unbelievably difficult. But gradually, I mean, kids are resilient, and they just get used to life, and they just got used to me coming home and not touching them, stripping off, having a shower, decontaminating myself before seeing them. They just got used to it. And I think now in the second wave, I'd really love to have been vaccinated already, but like many, many frontline staff, we haven't had a vaccine yet, sadly. But you just meticulously follow the simple rules. So I obsessively wash my hands. I wipe down my car keys, my mobile phone, the front door when I arrive in the house. I do absolutely everything I can to protect myself from catching the disease. And I think to myself that 2020 is a time where we've all stepped up, and we've wanted to do that because patients are dying in numbers we've never seen in our medical careers, and that's what you have to do. I think the fallout in the long term is there's going to be a huge mountain of probably post-traumatic stress among NHS staff. I think it's going to be very difficult, but the strange thing is at the moment, you just get on with it because it's our day-to-day job.
Well, Rachel Clarke, thank you very much indeed. And do me a favour, please, when your children get up tomorrow morning, say thank you from all of us for the things that you do, and tell them their mum is doing something that really matters. Thank you very much, Rachel Clarke.
Thank you.